First of all, I'd like to thank the organization for inviting me to this wonderful location. The theme of my presentation is Neuronatological Functions, a new trigeminal electrophysiological paradigm in masticatory rehabilitation. Regarding the paradigm, we don't have enough time to talk about the paradigms of Kuhn, but I can say that there are many differences between methods and paradigms. The first could change the opinions of colleagues, while the paradigms could change the science. It could change the interpretation of the biological phenomenon. Regarding the introduction, we should consider the masticatory system as a complex system that does not work in a linear way, but follows a stochastic process. The complex systems are composed of many elements which interact with each other in order to produce an emergent behavior of the system itself. So, also the masticatory system is composed of many elements which constitute two main blocks, the natological component and the neurophysiological one. These interact together to determine the emergent behavior of the mastication functions. However, we consider the natological component as a deterministic reality because we can touch it with our hands, we can observe it with our eyes, and finally we can interpret it through our current knowledge. While we consider the neurophysiological component as an indeterministic reality because we can't touch it with our hands, we can't observe it with our eyes, and finally, we can only hope to interpret it after it has been tested by external inputs called triggers. When the two components or the realities are coupled, then we can talk about physiology and maximum efficiency of the system itself. For example, if we want to understand this neurophysiological component, first of all, we have to divide the brain into three segments: the cortical and subcortical area, the peripheral area, and the brainstem area. As in all, the indeterministic reality, the system has to be tested in order to receive any response. After that, we can interpret and quantify the state of the system itself. For the above reasons, we have to stimulate each segment with different types of external triggers, taking into account that we also have to know the parameters of the trigger itself. For instance, if we want to quantify the integrity and the maximum neural energy produced by the trigeminal motor cortex, we have to test the cortic bulbar motor fibers by magnetic transcranial stimulation. This device produces a very high impulse of magnetic field, roughly 1.5 Tesla. That easily crosses the cranial bone and generates inside the cerebral tissue an inducing electric field, capable of depolarizing the corticobulbar fibers. This electrophysiological event is called cortex MEPS. If we want to quantify caudally the integrity of anatomic structure of the nervous system, we have to test the trigeminal periphery area. As you will be able to observe, in the next slides and video clip, we give to this area an absolute value because it will be considered as normalization factor. But to obtain this target, we have to depolarize the motor trigeminal root by electric transcranial stimulation. In order to cross the cranial bone and to reach the oval foramen, we had to develop a methodology called bilateral root MEPS, using new innovative devices equipped with a high voltage electric stimulator. The brainstem is the most critical area to be analyzed for the complexity of the polysynaptic circuitry that generates the reflexes. In any case, for our professional field, the most important reflexes are the jaw jerk, the mechanical and electrical silent periods, and the recovery cycle of the masseteric inhibitory reflex. In order to demonstrate the NGF procedures, I am going to show you a video clip to give us a brief idea. The neuronatological functions represent a new paradigm, which are essentially an evolution of classical natology in the masticatory rehabilitative disciplines. The functional neuronatological procedures are the result of the clinical process that must be executed step by step in a detailed way, beginning from the positioning of the electrodes. You can all observe the positioning of the recording electrodes and the ones which deliver electric impulses. The essential step is to test the entity of individual organic symmetry of the trigeminal motor system through the electrical transcranial stimulation of the trigeminal roots. Then, the electrical physiological result of this procedure is the recording of motor evoked potentials, or MEPs, of the trigeminal root on the masseteric muscles. In the electromyographic temporal window, you can see the averaged and saved EMG traces. Each one of them represents 10 trials. The 3 upper traces correspond to the right masseter muscle, while the lower ones belong to the left masseter muscle. The markers are automatically positioned with the possibility, by the operators, to correct them. They show the onset latencies in milliseconds with the standard deviation of the right and left masseter muscles. The markers also represent the amplitude peak to peak in millivolts of the 2 masseter muscles and its standard deviation. The software, furthermore, generates a Gaussian curve through a statistical algorithm that indicates the amplitude symmetry of the bilateral root MEPs. The amplitude symmetry is essential in order to build the normalization factor, which we will refer to from now on as organic symmetry. The following steps regard the analysis of neuromuscular responses of the brainstem area. The first reflex, the simplest one, is the jaw jerk. It is evoked through a tap on the chin with a neurologically triggered hammer that generates the start of EMG trace acquisition. For this test too, the markers are positioned in order to determine the onset latency and the amplitude. At the same time, the software generates the Gaussian curve of symmetry. As you can see, the Gaussian curve of symmetry falls out of the organic symmetry. This means that also in the rest position, the jaw jerk remains asymmetric. The following step corresponds to the analysis of the jaw jerk, executed holding the jaw in intercuspal position. As in the previous case, the latency and amplitude are automatically computed, as is the Gaussian curve of symmetry. The Gaussian curve of the functional symmetry, which is generated by the software and normalized to the organic symmetry, shows if the symmetries are overlapping or far away from each other. In this clinical case, you can see a high asymmetry of the masseter muscles. With the masseteric mechanical silence period, the complexity rises both for the type of the excited receptors and for the brainstem circuitries involved in the process. Also, the registration and analysis of the traces becomes slightly more complex, since the acquisition temporal window must be divided into two parts. The first part, called pre-analysis, is not modulated by excitatory nor inhibitory reflex components. The second part, called post-analysis, is modulated by the excitatory as well as by the inhibitory reflex components that generate not only the jaw jerk but also the masseteric silent period. The statistic analysis is performed using an algorithm in which the contribution of the acquired, averaged, and smooth traces of the pre-analysis area is compared to the post-analysis area. This process, in this case too, generates a Gaussian curve of functional symmetry, normalized to the organic symmetry. The patient has undergone a neuronatological therapy with a bite plane intraorally built through an electrical transcranial stimulation of the trigeminal roots. This method is called neuro-evoked centric relation. Here you can see the results. Leaving the other responses, like the jaw jerk previously mentioned, it is possible to see the evident recovered symmetry of the masseteric silent period, and in particular, an increase of the neuromotor recruitment in the pre-analysis, a definite silent period, and an efficient rebound effect. Before continuing, I would like to point out some concepts regarding the paradigmatic clinical cases. The NGF approach is to consider the masticatory system as a coin with its two specific faces. It would be impossible to give value to a coin taking into consideration the value of only one side. In the same way, we can't detach the natological component from the neurophysiological one. We can't make a diagnosis of malocclusion without turning the coin and looking at the other face. As you can see, the triggered peripheral area answers back, I find myself in a state of high anatomic symmetry and maximum efficiency. But when we go to test the brainstem area, it answers back, in this occlusal state, holding the teeth in intercuspal position with moderate neuromuscular activity, my motor neurons are facilitated by the gamma motor neurons in a high symmetrical way, but not only performing at maximum level when biting, recruiting all motor neurons available, also my polysynaptic inhibitory circuitry responds in a high symmetrical way. So the brain keeps saying, be careful what you're going to do, because the two realities are coupled. I know you understand the message that I'm trying to get across. In the same way, it isn't possible to say that we have reached a target in a patient undergoing orthognathic surgery if we don't turn the coin and look at the other side. So, as you can see, the triggered peripheral area answers us, I find myself in a state of high anatomic symmetry and maximum efficiency. But don't worry, anatomically it's alright. But when we go to test the brainstem area, it answers us, in this occlusal state, holding the teeth in intercuspal position with moderate neuromuscular activity, my motor neurons are facilitated by the gamma motor neurons in an abnormal way, decreasing the facilitation on the right side, but not only when I try to perform a maximum effort bite, recruiting all motor neurons available, I'm able to recruit only a few motor neurons, and my polysynaptic inhibitory circuitry fails to evoke the silent period. So the brain keeps saying, please do something, because the two realities are decoupled. I feel that you would like to know how, and for me, it's a pleasure to show you. As you saw in the video clip, we usually realize the bite intraorally through electrical transcranial stimulation of the bilateral root method that we call neuro-evoked centric relation. The result of this methodology is a simultaneous, symmetrical and maximal activation of all the masticatory muscles, innervated by the trigeminal motor system. Mechanically and spatially, the resulting vector is free from external influences, and so, as you can see, the mandible shifts towards the right side, recovering the incisal line. However, we are unable to say that we have reached the target without having asked the brain, "Are you comfortable?" The brain would answer us, "Thank you. Look at the symmetry of the jaw jerk. Thank you. Look at the symmetry of the silent period. And thank you very much. I have now recovered the coupling of the two realities." This clinical case was more complex to diagnose because the patient has complained of bruxism since adolescence, and his dentist had treated him with bite planes for many years. The difficulties also increased because the steps of the electrophysiological tests that you now know were on the borderline. But the brain kept saying, "Please, deepen your tests so you can decode my machine language." Therefore, we decided to perform the test of the recovery cycle of the masseteric inhibitory reflex. Unfortunately, I don't have enough time to explain this reflex. But briefly, I can tell you that we sent two electrical stimuli to the mental nerve, very close together. But the brain responded abnormally with the presence of this silent period by the second electrical stimulus delivered after 150 milliseconds from the first. The brain keeps saying, "Finally, you have been able to decode my machine language, because I didn't know how to tell you that I found myself in a state of hyperexcitability and that the bruxism was only a message sent out in human being language. Thank you. You saved my life." In fact, the final diagnosis was of pineal cavernoma. If someone wants more information about this case report, you can download the article on our website. Finally, I would like to conclude by saying that the NGF paradigm changes the logic of language, decrypting the brain code and compares the machine language with the natural language in order to improve the interpretation of the masticatory function.